Vaping has become increasingly popular in recent years, especially among young people. However, the long-term effects of vaping on respiratory health are still not fully understood. In this lesson, we will explore the potential impact of vaping on the respiratory system and discuss the latest research findings. Diacetyl is associated with a rare lung condition called bronchiolitis obliterans, commonly referred to as popcorn lung. This nickname originated from a link to diacetyl exposure in popcorn manufacturing settings. Despite frequent claims to the contrary, the notion that vaping leads to popcorn lung is still debated. Notably, cigarette smokers inhale over 10 times the amount of diacetyl compared to vapers, yet there is no established evidence linking smoking to the development of popcorn lung. Vitamin E acetate, which was found in cannabis e-cigarettes, was associated with a severe respiratory illness outbreak in the US known as EVALI. From March 2019 to February 2020, the US Centers for Disease Control and Prevention reported 2,807 cases of EVALI and 68 related deaths. In contrast, an investigation by the UK medicines regulator identified only 2 possible cases in the UK, both fatal, that conformed to the US criteria for diagnosing EVALI. However, these 2 cases turned out to involve synthetic cannabinoids. Determining the long-term effects of using non-tobacco nicotine will require many years, and data gathered from various experimental and epidemiological studies. Smoking has been extensively studied for over 70 years, revealing significant health risks, whereas vaping has only been prevalent since 2007, making it difficult to fully assess its long-term effects. Nevertheless, the latest independent review, conducted in 2022 to guide government policies and regulations, determined that vaping carries just a fraction of the risks associated with smoking. Many of the studies to date have focused on short-term outcomes or are limited by small sample sizes, short follow-up periods, or the rapidly changing nature of vaping technology and product formulations. Long-term cohort studies are needed to better understand how prolonged use of e-cigarettes affects human health.